Hello, my name's Mike and this is a video about personal independence payment, daily living activity number 3, which deals with monitoring your health condition, managing home-based medication and managing home-based therapy. As always, the assessment is about the help that you would need. The help you need to do these things safely, to do them to an acceptable standard whenever you need to in the day, to do them in a reasonable period of time. Sometimes the reasonable period of time rule confuses people with this activity, because a reasonable period of time for PIP is no longer than twice as long as a person who doesn't have your condition would take. And people will say to me, well, if they didn't have my condition, they wouldn't be taking my medication. So how are we supposed to do that comparison? But as always with PIP, it's sort of hypothetical. So, for example, it might relate to two different things. I might say, because of my arthritis in my hands, I have difficulty taking my angina medication. It takes me 2 minutes to do that, where my friend, my partner, could do that in just 30 seconds. Or it might all relate to the same thing. Because of my arthritis in my hands, it's very difficult for me to take the pain medication for my arthritis. It takes me 3 minutes to get a paracetamol popped out of the packet, whereas it would take my wife 15 seconds. What do we need to tell them about then? Well, as always, I've got my checklist, every possible PIP question. And as always, the first question is about aids. What things do you use to manage your medication? The use of aids only relates to managing medication. It doesn't relate to home-based therapy. It doesn't relate to monitoring your health condition, just the managing medication. Next question. This relates to all parts of this assessment. What prompting do you need? Prompting, reminding, encouraging, explaining in order to monitor your health condition, manage your medication, manage your home-based therapy. Next question, as always, it's about physical help. What physical help do you need? And the next question, as always, is about having someone with you all the time you're doing this task to keep you safe. The final question, what if you still can't do it in a reasonable time? What if you still can't manage your medication or therapy without an unreasonable degree of pain? What if you still can't do it whenever you need to? The most common information that people want to communicate to the decision maker comes under the first two questions about aids and prompting and reminding. So here's an example of one which I worked on recently. The gentleman concerned said, in relation to aids, what things do you use to manage your medication? He said, my pharmacist puts all the pills I have to take into a blister pack for me. Sorted. Aids to manage medication, 1 point. Next question. To monitor your condition or to manage your medication or therapy, would you usually need someone to prompt you, remind you, encourage you, or explain things to you? If so, which and why? And what he replied to that was, even with the blister pack from the pharmacist, I always need reminding and prompting to manage my medication. My memory and concentration have been affected by my illness, so my wife Helen, she gets me to check the blister pack on each occasion that I should take my pills to make sure that I've done so. Prompting, reminding, encouraging, explaining, once again, that's 1 point. We don't add them together, 1 point for aids, 1 point for prompting. No, you get the points from the highest scoring descriptor that applies to you most days. The two descriptors that apply are the same 1 pointers. He scores 1 point. Where you need help with therapy, the score that you get depends upon how many hours a week you need that help. So make sure you're clear about that. Hopefully, if you're completing a PIP form, if you're dealing with a mandatory reconsideration or appeal, you will find my checklist useful as a way of identifying the things that you need to communicate to the decision maker or the tribunal panel. I'm sorry, I can't deal with individual cases. But if your organisation needs some training, please get in touch.